Hello friends, in this video we are going to see about the angle of Louise, that is the sternal angle. We will see in the further points like what is this angle, what is the situation of this angle, what are the events occurring at that angle and what is its applied. First, it is a bony angulation which is formed at the junction of the manubrium and the bone of sternum. That is, in diagram we can see that here it is the manubrium and it is the sternum. Here at this junction we can see the angle of Louise. Here we can see that it is an angular notch, it is the manubrium and it is the sternum, where we can see here it is the angle that is called as the angle of Louise. Now, what is its situation? Its situation is that it is situated 5 cm below the suprasternal notch. Suprasternal notch, that is this. That is also called as jugular notch. Suprasternal notch, it is from below 5 cm that the angle lies. That is the angle of Louise. Then, what are the events that are occurring at this angle of Louise or the sternal angle? We can see that there is a formation of the cardiac plexus. Then there will be the upper limit of the base of heart. Now at this junction there will be the ending of the ascending aorta and the arch of aorta gets begin at this angle, that is the angle of Louise. Now pulmonary trunk it divides into two pulmonary arteries at this junction, that is at the junction of the manubrium and the bone of the sternum, which is also called as the angle of Louise. Now here we can see that trachea gets divided into two principal bronchi. Trachea gets divided into two principal bronchi at this junction, that is the angle of Louise. Azygous vein, it opens into the superior vena cava at this junction and thoracic duct crosses the right to the left. In this way, these are all the events that we can see at the angle of Louise. So it's a very important junction that we see. Now, what is the applied that we can see of the angle of Louise or the sternal angle? That is, it is an important landmark for counting the ribs. During the examination or during the percussion, important site that we have to remember while counting the ribs is the angle of Louise, that is the sternal angle. Here, from here we can start, that is at this junction there will be the second rib. This is one of the important points that we have to remember. In this way, we have seen angle of Louise or the sternal angle in short. Thank you.